As an experienced and aged doctor, I have seen what a heart attack can do, especially to people who live alone after 60. It's scary, and it happens more often than most realize. Nearly 800,000 Americans suffer one every year, and many don't get help in time. In this video, I'll share 7 life-saving tips that could help you stay alive until help arrives. Don't skip any part, because one small detail could make all the difference. A heart attack basically happens when blood can't reach part of your heart because a fatty blockage cuts it off. What's tricky is that many heart attacks don't start with that dramatic pain we see in movies. They often creep up slowly with pressure or shortness of breath that people ignore. When that happens, every second actually matters. The heart muscle starts getting damaged really fast. People over 60 are simply more at risk, especially if they have high blood pressure, diabetes, or high cholesterol. Men tend to face it a bit earlier, but after menopause, women catch up quickly too. Smoking, stress, and poor eating habits make things even worse. So let's discuss the 7 life-saving tips that are going to save your life. Number 7. Use aspirin immediately if safe to do so. After your 50s, I'd say you should always have aspirin at home. Aspirin helps by thinning your blood, which makes it harder for clots to grow and block the arteries feeding your heart. During a heart attack, a blood clot forms around a ruptured fatty deposit in the artery, cutting off oxygen to part of the heart muscle. Chewing aspirin helps slow that clotting process almost immediately. Now, the key word here is if safe to do so. Not everyone should take aspirin in an emergency. If you're allergic to it, have a bleeding disorder, stomach ulcers, or have been told by your doctor to avoid it because of certain medications like blood thinners, skip it and wait for help instead. For everyone else, one regular 325 mg tablet or 2 baby aspirins, 81 mg each, is usually recommended. Make sure to chew it, don't swallow it whole, because chewing lets it absorb faster into your bloodstream. Doctors have long backed this up. In fact, a study published in the American Heart Association's journal found that taking a 325 mg aspirin within the first 4 hours of severe chest pain could potentially prevent around 13,000 deaths every year in the U.S. if used widely and correctly. Here's something practical. Keep a small strip of aspirin where it's easy to grab: your bedside drawer, purse, or even next to your TV remote. Some people also keep one in a small container on their keychain. You might never need it, but if that sudden chest pain or tightness hits, you'll be glad it's there. Always remember, call for help first, then take aspirin, only if it's safe for you. Number 6. Take slow, deep breaths. I know most people will panic in a time like this, and it's a natural response, especially when you are alone. But it's also the time to keep your head calm, because that's what your heart needs the most at this crucial time. And for that, you should take slow and deep breaths. Breathing slowly can actually help stabilize your body and mind. Science shows that deep breathing slows your heart rate, lowers stress hormones, and helps more oxygen reach your heart muscle, which is struggling to get enough blood during an attack. When you panic, your body releases adrenaline, causing your heart to beat faster and your blood pressure to rise, making things worse. But when you breathe deeply and slowly, it sends a message to your nervous system that says, "Calm down." This helps reduce the workload on your heart. Researchers at Harvard Medical School found that controlled breathing for even 1 minute can lower blood pressure and improve oxygen exchange in the lungs. Here's what to do. Sit upright and place a hand on your chest. Inhale slowly through your nose for about 4 seconds, hold for a second or two, then exhale gently through your mouth. Try to keep your breathing steady and quiet. If you start to feel dizzy, pause and return to normal breathing. These calm, deep breaths also help you stay focused, so you can follow the dispatcher's instructions clearly and conserve your energy. It's not a cure, but it gives your heart a fighting chance while help is on the way. Number 5. Loosen tight clothing and sit upright. When a heart attack strikes, something as simple as how you sit and what you're wearing can actually make a real difference. Tight clothing, especially around your chest, neck, or waist, can restrict your breathing and make it even harder for your heart to get the oxygen it desperately needs. That's why loosening tight clothes, like belts, collars, ties, or fitted tops is one of the first things you should do. Once you've loosened up, sit upright instead of lying flat. Here's why. When you lie down, blood flow to the heart and lungs increases, which can make chest pressure and shortness of breath worse. Sitting upright keeps your lungs expanded and helps your heart pump more efficiently. Hospitals often use a similar position called the semi-Fowler's position for heart patients because it reduces strain on the heart and improves oxygen flow. Studies have shown that patients in this position often breathe more comfortably and maintain better oxygen levels. Think of it like giving your heart and lungs a little breathing room. Literally, gravity helps keep fluid away from your lungs, which is especially important since many heart attack victims experience fluid buildup that causes that feeling of suffocation. If you're alone, choose a stable chair or lean against a wall for support. Don't lie on your bed or floor unless you're about to faint. If you have chest discomfort and feel dizzy or weak, try to keep your head slightly elevated and avoid unnecessary movement. The less your body struggles, the more energy your heart can save for until help arrives. According to medical experts, these simple body adjustments can actually help maintain circulation and oxygen levels until professional care takes over. Number 4. Cough strongly if you feel faint. The idea of coughing during a heart attack might sound unusual, but there's real science behind why it can help in certain moments, especially if you start to feel faint or lightheaded. This action, sometimes called cough CPR, has been studied in emergency medicine and cardiology as a way to keep blood flowing to the brain when your heart rhythm becomes unstable. Here's what happens. During a heart attack, the heart may start beating irregularly or too slowly, reducing blood flow to the brain. That's when people suddenly feel dizzy or about to pass out. A strong, deep cough creates pressure inside your chest, which temporarily pushes blood out of the heart and toward your brain and other vital organs. It's not a cure, but it can buy you a few precious seconds until help arrives or your heart rhythm stabilizes. In hospital studies monitored by cardiologists, patients who were about to lose consciousness during certain irregular heart rhythms were instructed to cough every 1 to 3 seconds. This action helped maintain circulation and even allowed them to stay alert long enough for medical staff to intervene. However, experts stress this method only helps when done correctly and in specific situations, mainly if you're already conscious, alone, and feeling faint while waiting for emergency help. To do it properly, take a deep breath and cough hard, as if you're trying to clear something from your chest. Repeat this every couple of seconds if you start feeling weak or your vision dims. Each cough forces a small pressure wave through your chest that helps keep blood moving. Still, it's important to understand that cough CPR is not a replacement for calling emergency services or using a defibrillator. It's simply a temporary measure to help you stay conscious while waiting for help. Researchers from the European Society of Cardiology note that even brief, forceful coughing can stabilize heart rhythm in some cases, giving your heart just enough support to hold on until professionals take over. Number 3. Unlock doors and make access easy for help. When a heart attack strikes, every minute counts, literally. Studies show that most deaths from heart attacks occur within the first hour after symptoms begin, often before the person even reaches the hospital. That means the time you spend waiting for help is critical. Once you've called emergency services, your next move should be to make it easy for rescuers to reach you. If you can still move safely, unlock your front door right away. Paramedics often lose several minutes trying to break through locked doors or gates, and in heart emergencies, those minutes can mean everything. If you live in an apartment or a gated community, buzz the gate open or tell the dispatcher any codes they need. Keep a spare key somewhere accessible, or consider a small emergency lockbox. They're inexpensive and widely used by seniors who live alone. You usually have a few minutes of awareness before symptoms intensify. Chest pressure, sweating, nausea, and shortness of breath tend to build up gradually. Use that window wisely. Unlock doors, clear a path, and keep your phone beside you. If you can, sit somewhere near the entrance in an upright position where paramedics can reach you easily. Tell the dispatcher if the door is unlocked and whether you have pets or obstacles inside. They'll relay that information to the responders so they can get to you without delay. In many cases, ambulance teams reach homes within 8 to 12 minutes after a 911 call. But faster access means faster oxygen, medication, and heart monitoring, the things that can truly save your life. So, don't wait until it's too late or assume you can tough it out. A few small actions, taken calmly and quickly, can help the right people get to you just in time. Number 2. Keep movement to a minimum. And finally, the number one thing you should keep in mind during a heart attack is don't move unless you absolutely have to. Yes, it's the simplest and easiest thing and can truly save your life. When your heart is under attack, it's already struggling to pump blood through a blocked artery. Any extra movement, even standing up quickly or pacing in panic, makes your heart work harder and use more oxygen, which can worsen the damage. Medical experts agree that minimizing physical movement during a heart attack helps stabilize your condition. According to studies published in the European Heart Journal, patients who stayed still and rested while waiting for emergency help had better survival outcomes than those who tried to walk, drive, or move around for assistance. Staying still gives your heart a fighting chance to keep blood flowing where it's most needed. Here's what you should do. Sit down in an upright position, ideally against a wall or in a sturdy chair, to help your breathing. Avoid lying flat, as that can make breathing more difficult and increase pressure on the heart. If your phone isn't within reach, shout for help rather than walking to get it. Even short bursts of movement can raise your heart rate sharply. If someone else is with you, let them take care of unlocking doors, calling for help, or getting your medication. Your job is to stay calm, breathe slowly, and let your body conserve its energy. It might feel unnatural to do nothing, but remember, your heart is fighting hard to keep you alive. Every ounce of calm and stillness gives it the strength it needs until professional help arrives. At the end of the day, the best way to survive a heart attack is to stop one before it even starts. Get your blood pressure, cholesterol, and sugar levels checked regularly, even if you feel fine. Make it a habit to stay active, eat balanced meals, and manage stress. Small lifestyle changes really do add up. Your heart has been working nonstop since before you were born. It deserves some care in return. Number 1. Call for emergency help right away. When you think you might be having a heart attack, the very first thing you should do, without hesitation, is call for emergency help right away. Don't wait to see if the pain goes away, or try to handle it on your own. I know it can be hard to believe something so serious is happening, but every passing minute can mean more damage to your heart. Doctors often say, time is muscle, because the longer your heart goes without enough blood flow, the more of that muscle gets permanently damaged. According to the American Heart Association, people who get medical treatment within the first hour of symptoms are far more likely to survive and recover fully. Yet, sadly, many delay calling for help, sometimes out of fear, confusion, or denial. A recent study found that more than 40% of heart attack patients waited over 2 hours before seeking help. That delay can be deadly. If you live alone, make sure your phone is always close by, even when you're resting. It's also a good idea to keep emergency numbers saved on speed dial, or set up a medical ID on your smartphone. If you can, tell the operator clearly that you're having chest pain or believe it's a heart attack. They can guide you step by step until help arrives. In the UK, a 60-year-old man named John Thompson woke up in the middle of the night with crushing chest pain. Instead of waiting it out like twice before, he decided to call emergency services right away. Paramedics arrived within minutes, but by then, his heart had stopped. Because he made that quick call, they were able to restart his heart on the spot and rush him to the hospital. His doctors later said that if he had waited even 5 more minutes, he likely wouldn't have survived. That one call saved his life. So, please, never feel embarrassed or uncertain about calling for help. It's always better to be safe than sorry, and making that one quick call can truly be the difference between life and death. Stay informed, stay prepared, and stay kind to yourself. And if you found this helpful, make sure to subscribe and share. It might save someone's life.